Hi, everyone. We'll go ahead and get started in just a couple minutes. We'll give people an opportunity to sign in. It looks like they're continuing to do so. Now, if you feel comfortable, please put your camera on if you have one. It's really nice to see faces if we can. Don't worry about bad hair days. I have them all the time, so I'm not, I've decided I'm not gonna worry about that anymore. So thanks. We are going to have, and for those of you who are on right now, we're going to have Susan Collins, who's up on the screen, talking about Magnet. Many of you may have seen the signs and the emails and everything else, all things Magnet related, and giving us some updates. The ARNPs in our group will be a part of the overall Magnet conference, but I'll let Susan talk about that and we'll give it another, as soon as my clock hits 12:03. So we got a couple minutes left. And if anyone has any interest, or excuse me, if anyone has anything that they'd like to put up on the agenda, please feel free to put it in the, oh, there's no chat available. I don't know how to do that. So you'll have to, just raise your hand and we can write it down. I'm sorry that it's not, that there's no chat. I'll ask that our Zoom get that added as well.
Kelly, can you remind me how long I have to speak?
Just take the time that you need, but not the entire 58 minutes. How's that?
It's a broad range. I'll keep it around 10. How's that?
That sounds good. Susan, if you want to stay on and let me go through a couple of things, that'll give a few more people opportunities to sign on, so as many people as possible can hear your message, if you'd like to do that. All right, great. All right, well, it's 12:03, so we're going to go ahead and get started. Thanks everyone who's on the call. I'm sure more people will join. I appreciate you taking time out to join our meeting today. I wanted to just go through the agenda. I'm not going to share screen and go through all of the slides because, one, I don't think we're going to be able to get through all the slides. I think there's too much information. There's not too much information in the slides because I think it's an amazing slide deck, but I think it's also really a valuable resource for those folks that haven't been able or aren't able to join today's meeting. So we'll just go over the agenda. And the first thing that Michelle has written up is recognition for staff. So there's a couple of staff that I'd like to do, or actually there's at least 4 staff I'd like to do shout outs to. I see Diane Wheeler is on today, and also Trish Rapar. Both of those, both of you guys were wonderful in the Schwartz rounds that you have each participated in. I really appreciate your perspective of being a provider and just being here in the time of COVID. I think the information that you shared from a personal perspective about not only the impact that it has here at work, but if you have families or as you're caring for folks, was really, really moving. So big shout outs to you guys for participating. And then Audrey Branham, a PA from the spine clinic. I'd like to commend Audrey, who is the physician assistant in the neurological surgery clinic at HMC. Since my first experience at Harborview, I've been fortunate to be on the receiving end of Audrey's patient care. She was always upbeat, articulate, very easy to talk to about my health concerns and symptoms. Her knowledge is thorough and easily understood. If she doesn't know the answer to my question, she seeks out the person who can provide one. So thank you, Audrey, for providing such good care to our patients. And then the other one is I have been working with Ellie Fouts, one of our new ARNPs on the spine team for the past few weeks. I just wanted to reach out with some very positive feedback. She has been truly phenomenal to work with. She has tremendous clinical acumen and instincts, a wonderful attitude, has been taking thoughtful care of our patients, and overall has just been a pleasure to work with. The whole spine team has been thrilled to have her as a member, even if only temporarily. I know she will ultimately be working nights, and in that role, I'm certain she will improve the care of our orthopedic patients and be an invaluable member of our ortho team. So congratulations, and we really welcome Ellie, to Harborview. She's very new to her role here. And then lastly, welcome to, we had a few hires these last couple of months. Ellie Fouts started in orthopedics in January. Violet Robb started in sleep. Richard Hedstrom started in neurosurgery. And then in February, March, Dana Mahan started in the neurosurgery clinic and Fong Fong in orthopedics. So welcome. If you see your colleagues, please share your excitement about Harborview with them. We're really happy to have them. And I think they will ultimately be just fantastic members of our teams. And then we have several people pending hires. We have Ty Moses, who's coming to orthopedics. Akiko Soel, I'm not 100% certain I pronounced the last name correctly. She's going to be in the general surgery clinic. Katie Pack is coming to GI. Anthony Barrero will be our third float position. Megan Darrow is coming to neurocritical care. Joanna Heron is coming to neurocritical care. And Chi Ross is coming to neurosurgery. So those folks will all be here probably within the next 3 to 5 months. Of course, everyone remembers that credentialing experience. So it'll be a little while, but we're looking forward to having all of them start. So, excuse me, it looks like we have a few more people. So Susan, we can keep talking a little bit or go straight to Magnet. I want to be respectful of your time.
Thanks, Kelly. I'm pretty open, so I'm happy to go, or let people sort of trickle in, or if you'd rather cover a few more topics, that's fine too.
Yeah, they actually may still trickle in a little bit. So why don't we go ahead and do, let us do a couple more, let me do a couple more areas. I'm going to go to open positions. I just wanted to encourage folks, if you know anybody that would like to work at Harborview, the best way to get referrals is by our own current staff. So we have multiple positions available. And I also want to share that those multiple positions, we were in a JLM with several staff on Friday, actually. And one of the questions was, how many open positions did we have? I actually didn't know the answer because we may have some positions that are listed as open in the screen that I see, but they're really hired. We're just waiting for them to start. So we actually have 1, 2, 3, 4, 5, 6, 7, 8, 9 positions vacant. But those 9 positions, actually that's not accurate either. So let's go with the 15 that I thought about and shared with the JLM. The thing about the positions that are open is many of them are actually newly created positions. So it isn't a case where people have left and gone on to other positions. Now, that definitely happens, but many of these programs, or excuse me, many of these positions are also newly created. We have 2 newly created burn positions. 3 of our float positions are brand new positions. One of our downtown programs just opened a position. A new clinic is going to be opening. And we had a new neurosurgery position that was open a little while ago. Actually, I'm not 100% certain if it has been filled, but we do have people that are leaving, but we also are growing as advanced practice providers here at Harborview, which is really, really exciting. I can think of 8 positions, just the float positions and the burn positions are all new within the last maybe 7, 8 months. So it's really exciting to see as our census stays high and we continue to be super busy, the patients need care. And one of the groups that does an excellent job is us, the advanced practice providers. So if you know anyone that's interested in working or coming to Harborview, please let us know. We have a downtown program position open. Neurocritical care has another position that is still, or not still, but another position open. We have an outpatient neurosurgery position that I think we're right in the middle of recruiting for. And we have a couple of inpatient float positions still available. We have a couple of emergency department positions open. I have a float psych emergency service, or excuse me, a per diem psych emergency service position. We have 2 burn service positions and general surgery positions. So if anyone is interested or knows anybody, please have them reach out to Michelle, Jenny, or myself. So thank you for that. And then the other thing that I wanted to bring up is vaccinations or immunizations. For those of you that may not have been aware, the booster is attesting to a booster or declining a booster is mandatory. So you either need to get your booster or go through the declination process, very similar to the flu shot. So if you haven't gotten your booster, you either intend to get the booster or you intend to decline, please reach out to employee health, as that needs to be done by the end of March. So March 31st is the deadline. And I believe that's a hard stop. So please don't wait till the end. All you have to do is go down to employee health if you're electing not to be boosted, but you still have to do that. So thank you for that. All right, Susan, I'm going to introduce Susan Collins. Welcome to our meeting. Susan Collins has been the nurse leader that is spearheading our magnet journey. And Susan, if you'll give a quick rundown, I don't know what your agenda is today, but just when we started to the fact that we are as close to the finish line, I think, as we can possibly get. So thanks, Susan, for taking some time to come to our session today and talk about what the expectations are for our advanced registered nurse practitioners when Magnet comes.
Thanks, Kelly. Thanks for having me. And thanks to the group for allowing me some of your time. I know it's really important that you all get together and share all these important updates. And so I don't want to take up too much of your time, but I do have a prepared slide deck because I am a visual person and I think that helps me stay on track as well, because I also tend to wander. So I'm going to give you all first a quick overview of what Magnet is, very briefly, talk a little bit about what's coming for us and how you can help support the efforts here. So let me see here. So a little bit about me. I started as a firefighter paramedic in California as a child, basically, which was a great experience in that it really taught me the value of being pretty professionally courageous and just doing things that nobody had done before. And so this is going to come into play in a little bit. But I moved to Washington for nursing school and then went as a nurse tech on 8 East. Went right into trauma surgical ICU as a new grad based on my paramedic firefighting experience. That was very helpful. I worked there for about 11 years. I loved every minute of it, and then decided I needed to sort of try something new. So when this Magnet program coordinator position became available, I was in the middle of grad school, but thought it would be a great opportunity for me to put my love of advocacy and nursing and academic writing and storytelling really to good use. So it's kind of a quick background on me. What I do currently, I do a lot of advocacy for frontline staff, both nurses and non-nurses alike, in terms of ensuring that their voices are heard and that we have opportunities to participate in shared governance, that initiatives that roll out are always, they always consider the frontline voice. I do a lot of helping frontline nurses find the resources that they need, and that is also part of my job is to ensure that we adhere to these sort of magnet standards in all the things that we do. So cheerleading, monitoring, caring, all of those things that I think make me who I am, which is great. So Magnet really was started, just a quick history, it was born out of the 1980s nursing shortage, and a group of nurse researchers really took a hard look at the hospitals that were doing things correctly. What were the common themes that were helping hospitals retain their nursing workforce in particular, and also recruiting? And so we're facing the similar issues right now. And so this is a very timely designation. The focus that they found were these structures and the processes that these hospitals had in common. Things like access to educational funds, a shared governance structure that really afforded folks opportunities to come and share ideas, access to leadership. Do we have visible folks, and are folks rounding on us? So these sorts of ideas and tenets became the forces of Magnet that we know today. And the American Nurses Association got wind of this study, formalized the Magnet program, and then the American Nurses Credentialing Center took over the ownership of the program and the designation. It's not an accreditation, it's a designation, just to be distinct. And again, the focus is that retention is far more cost effective than recruitment in terms of training costs. But what I think is important as a lifetime Harborview member, really my beginning of my career has been here, is knowing that our culture is pretty invaluable. And when we lose folks with any number of years here, we lose intellectual capital and the ability for our workforce to really be efficient. And it's not to say that new hires or travelers don't bring stuff to the table, but it certainly is it is a difficult thing to replace somebody with 10 to 15 years experience. So to that end, I think we find a lot of important reasons to keep folks where we are. In addition, the Magnet hospitals have been shown to have better patient safety outcomes and better patient satisfaction outcomes in also nursing satisfaction outcomes. Quickly, where we started way back in 2014 and probably earlier with Pam Guntram and Paula Mitten-Foltz talking with frontline nurses about how to formalize our shared governance structures, all the way through 2019 when we formalized our Magnet program and I was hired to lead these efforts. We had COVID interruptions in our data and our writing staff that I had recruited. A couple of you have helped me write documents. So thank you for that. But we persisted despite the challenges. We were able to finally apply in August of 2021, which was an 1,800-page document, which was comprised of 96 examples through all corners of Harborview, inpatient, ambulatory, operating room, all the clinics, the emergency department, every single aspect of Harborview was represented in this document. And then finally, we are looking at a site visit coming up at the end of this month, over 3 days. We've elected to do this virtually. And so we are one of the first folks in this area that will be doing a virtual Magnet visit. So again, just learning how to build the bike as we learn to ride it as well. So typical fashion. So I'm excited. This is really celebratory. In addition to the stories, we did have to submit and outperform over the most recent 8 quarters of data in these 3 domains. So the first is nursing satisfaction. And just to refresh everyone's memory, and then those of you who are new, we last surveyed our nurses in October of 2019. On April 4th, we'll be rolling out a combined survey tool enterprise-wide that will be including your teams as well. But we had to outperform our benchmarks just to even apply. So that just kind of shows how important it is to have a healthy, happy, engaged workforce. The next set of data we needed to submit was nursing sensitive indicators, things like our hospital acquired pressure injuries, falls with injuries, CAUTI rates and CLABSI rates, and we outperformed all but falls with injury. So that was fantastic. Just as an aside, these recent 8 quarters of data did also include our COVID, the peak of COVID. So despite all those challenges, we still managed to outperform. And the same goes for patient satisfaction scores. We outperformed all of our patient satisfaction scores in all areas. So I'm incredibly proud. So Magnet designation really speaks to things like our exemplary professional practice. How do we partner with our nurse colleagues? How do we partner with our ancillary staff? How do we partner with our patients and families? The transformational leadership aspect, which is, do we get support? Do we feel supported by our leaders? Are we able to access them? Are they in great contact? Do they communicate well? Do we have a CNO who's visible? And then new knowledge, things like research. Are we able to contribute to the body of research from Harborview and beyond? And are we able to share it? Do we have the support to build on our own education? So we are already doing so many of these things. It really is about being recognized for the work that we do on the front end and the back end. And so our site visit is really going to be a celebration as opposed to a survey in my mind. Again, more pictures of just everyday excellence. And these are obviously pre-COVID pictures, but it's a reminder of what used to be and what hopefully will happen again when we all can get together without masks and share food. So, and then conferences, I'm hoping we can all, again, take advantage of our continuing education funds to attend more conferences here and across the states. So why are we working so hard for this designation? Not only do we feel like it is, we're well deserving of this, but it does set expectations going forward that we do rely on empowered RN workforce. And this is nursing, this is a nursing focused designation, but it does not mean that we ignore the fact that we are an interprofessional group. No person or no group works as an island. And this document and the application reflects a lot of those interprofessional relationships. But in order to continue to sustain this designation, it is every 4 years, and every 2 years, we need to submit all that data again. So it's a great partnership between frontline staff and our administrators to ensure that we have these processes and these structures continue to stay in place and very strong. And the feedback that we receive, it really does go all throughout the hospital once we get our designation and the report that follows. So we know where we can strengthen and where our opportunities are. So as Kelly mentioned, we're so close. Our site visit is over 3 days. There are going to be sessions, unit tours, specialty nurses. They want to speak with legal, with risk, with HR, our educators. So they want to speak with most every group that is represented here at Harborview, including yours. So there's a specific session for ARNPs on Friday, April 1st. Kelly is going to be receiving a calendar invite. I'll also send that to Melissa Kelly. So if you're not, and then if I could ask her to forward that along to the group here, that would be really great. It is specific to nurses. I apologize to the PAs and the other folks on this call, but again, I want to ensure you that your stories are told regardless.
Susan, I'm just going to interrupt.
Yeah.
If there are ARNPs on this call now and you would like to participate, don't hesitate to reach out and email me and just say, yes, I'm available on Friday, April 1st to participate in the call. Jenny, myself, and Michelle listened with our consultant, or not listened. We answered questions with our consultant, and I think our group is going to be very well prepared to present. And a lot of, I shouldn't say a lot, but questions also are really related to the interdisciplinary nature of nursing and the nurse practitioners and the PAs and how they are integrated with medical staff, the physicians in general. And I think the more ARNPs we have at this session, I think, Susan, did you want like 15 or something?
However many, there is no
okay.
max. Yeah.
Oh,
absolutely.
okay, great. You all are really going to be well prepared to speak to some of the questions about working with your physician colleagues. So if you're interested, please reach out. It's an awkward time for some, I know, because you might still be rounding or something, but if there are people that can break away or like to participate, just please let us know. This is really an exciting thing. So sorry, Susan, for interrupting.
No, I appreciate you filling in a lot of these details for your team as your experience, you know, as you experienced it. Again, this is not a gotcha sort of call where they're going to be trying to poke apart your adherence to policies or your knowledge of procedures. It's really speaking to, like Kelly said, how you feel, how do you work together? What do you like most about your partnerships with each other? So I don't want this to sound, intimidating, because I think it was really great to hear that so many organic things. It didn't seem like we needed to prepare anybody to speak to why they like it here. So thank you, Kelly, for that. Here it is, sort of what I just said. It is celebrating our achievements. The ANCC appraisers, there are 3 of them. They're all nurse leaders, so assistant chief nursing officers in various hospitals around the West Coast. And they're excited for us. We've done the hard work. We've already demonstrated outperformance and excellence. Now is the time. They just want to kind of kick the tires a little bit and ensure that we not only talk the talk, but we walk the walk. So they'll be asking me, especially some follow-up questions about examples. They really want to hear, not necessarily from administrators or chief executive officer or anything. They really do want to speak with frontline staff about experiences in those areas that I spoke, and Kelly really helped fill in the gaps there. How you can support. If you're asked to participate, which is really great if you can, be sure to share what you're proud of. We don't want anyone to try to feel like they have to fake that things have been perfect here. Answer honestly if you're asked about the challenges we've been facing, but also know that this is a chance to really brag about the hard work we've done. If you are tracking specific metrics, they may ask you, what are you tracking in your practice in terms of patient safety or patient outcomes? It'd be great to know what you're doing and just sort of reflect on that. Access to Excellence is a place that I know is undergoing a lot of updates at the moment, but that's typically where we find our data. So this is just sort of concrete ways as you're thinking about joining this call to support us. So once they leave, they will likely take a few months to make their recommendations. So the appraisers don't decide. The appraisers make recommendations to the Committee on Magnet, but hopefully we'll hear in around June whether or not we receive this designation. I think that's all I have, except for, oops, I wanted to say thank you and I hid that slide accidentally. Let me show you again. There it is. Here's my contact information. If you are interested in being a part of that call on April 1st from 11-ish to around 11:50, please let me know, let Kelly know. We'll get you the Zoom link and the invitation out. I'm always happy to talk about Magnet with anybody. So Kelly, thanks so much for having me.
Yeah, no, thanks, Susan. I do think one of the things that our consultant did recommend was, for those of you that may sign on and say, yes, I would love to participate in this, is being on time. That it's really important that we're on time. So if it's at 11:05, we need to be there at 11:04. So we're up and ready to go. If someone has said, yeah, I'll be there, and it's 11:15, please don't sign on. It's a courtesy thing, and I think it's just, I think it's a culture for Magnet that if it starts at 11:05, we need to be there at 11:05, and also that we just turn our phones off or keep them on silent. And of course, if someone got paged out, I mean, we still are working. It's a 24/7 operation, so that we still have our jobs to do. And if we do have to leave, we can quietly, exit the Zoom meeting. But I think that was, and then always if we are stopping somebody in the hallway, and I don't know what the odds of this would be, or out on the unit, just please remember to introduce yourself, kind of do your own personal aid, like how long you've been at Harborview, and what area you're in and who you are. And as Susan mentioned in the slideshow, it is an opportunity for us to show all the work that we have done, and all the work, actually, it's an opportunity for us to cheerlead the work that we do here at Harborview and the special nature, because I do think it's special here at Harborview, the special nature of Harborview, and why we love caring for the patients and doing the work that we do with the colleagues that we have. So that's the other piece that I think is really important. And it's been a journey, and it's just amazing to me that I remember one of the first meetings with Darcy when we started talking about, or she started talking about her desire to be a magnet designated hospital, because there's not very many safety net hospitals that are magnet designated. I think the other thing that is interesting, and when you think about a safety net hospital, it's the majority is Medicare and Medicaid patients, which is what we are. So the majority of those hospitals are primarily getting their revenue through commercial payers. So it's really cool that we have passed all of the milestones that we need to pass as a safety net hospital. So I'm really excited about that, and we're doing it, and that's wonderful.
Yeah, to your point, about 8% of hospitals across the world are magnet, and only 1% are safety net hospitals. So it's really impressive this is to see how far we can go on just pure creativity some days. I don't know the likelihood of folks being actually stopped in the hallway, Kelly, but it is good because we are doing unit tours. And so if you are on the unit that's undergoing an appraisal tour and you are asked to speak, that's a great point. Just again, it's your opportunity to brag and to shine and to share what you love about this extended family of ours.
Great, thanks. Does anyone have any questions before for Susan or myself, or is interested in perhaps participating on that Friday session? Well, you don't have to all speak at once or unmute your microphones, but if you are interested, please let us know. I'll be sending out requests as well. I know Friday at 11 might be a difficult time. I totally get that. But if anyone can, the other thing is we're looking at, and this may be a little more different from nursing on the floors, is asking for people to please help cover leadership. So if someone from neurosurgery is interested, I would see if Jenny might be able to cover, or one of your colleagues could cover for you while you participate. But it's a great opportunity, I think, to share what you do and how you do it with your colleagues. So
thank you so much again, everybody, and reach out if you have any questions. Have a great day.
all right, thanks, Susan.
Thanks again.
I had put spiritual care in the agenda, but I honestly didn't know how long we would be working, or Susan's presentation would be. So I kind of put that on hold, but I'm going to fill a little bit of a gap with the Resiliency Committee. I don't know how many of you know or participate in the Resiliency Committee, but I just wanted to let you know that we are a very diverse group in terms of having frontline staff, administrative staff, physicians, myself, administrative staff that are non-clinical, all participate in resiliency and support resiliency activities here at Harborview. And I just, I want to throw out that if you're interested in participating in the committee, please reach out to me, because we would love to have, we'd love to have you. I think it's quite a robust committee, actually, and it's a fun committee. We have no money, but it seems like we're able to make a lot of things happen. And so I can get a little bit of money from begging and borrowing, but anyway, if you would like to participate, please do so. We're working on music. Next week we have a meeting in Olympia with, I forgot what it's called, Arts Washington, actually, and then For Culture here in King County. We're working on seeing if we can't get grants to have some music here at Harborview and then our various areas up on the hill. We're also continuing our supportive conversations. If anyone would like to be in those conversations are kind of Vegas rules where anything can be talked about related to just kind of what's going on in your life related to COVID. It's not a problem solving committee necessarily, but it is an opportunity to share and get support from your colleagues. And the thing that's coming up, that's on the March 24th, it'll be at noon and then again at 5:30. So there will be some advertising coming up very, very shortly on that. The other thing that is being supported through the University of Washington or UW Medicine and the School of Medicine is the Trauma Stewardship Institute. There is going to be a lecture, educational lecture coming on March 23rd. It's a 2-hour training from, I'm going to forget her name, unfortunately. I've seen it so many times that now I can't remember it. I should remember it. Laura Vandernoot Lipsky, who was a social worker here in our emergency department and then founded the Trauma Stewardship Institute. But she's going to talk about secondary trauma, trauma in general, and doing some education. That training is, it's coming up very quickly. It was just, I think the money was approved to have her come and everything was decided on March 10th. So it's a quick turnaround for that. But she's also going to be doing a training in June. There's a flyer that's going to be put up on the message boards and then on the intranet, and we'll make sure to get that out to all of our advanced practice providers. Coincidentally, at the same time that the system was looking at having Laura come and talk, the nursing practice councils throughout Harborview were talking about having her come and talk and do some trainings for staff. So we're also going to be having her come for staff, Harborview staff, all-inclusive providers, anybody that wants to participate. She's going to do 2 lectures, one on the 30th and, one on the 29th of March from 12 to 1 and one on the 31st. The flyer is just going through some renovations and then that's going to go out. Those are going to be 2 1-hour lectures. It's going to be 30 minutes of lectures and 30 minutes of question and answers. We're also working on seeing if we can't get free CE for those 2 hours. So that's a process, more to come on that, but we'll let folks know if CEs are available. And we're going to do that for any staff that's eligible for CEs to see if people can't get CEs on that. I think those trainings are going to be really, really helpful, really timely, and really informative. I haven't heard her, I don't think I've heard her speak personally, but every person that I know that has heard her or participated in any of her workshops or gone onto that website has just been really, really positive about her knowledge, her experience, and her expertise. So just keep an eye out for that stuff, if you will. If you haven't looked at the art show, has anyone looked at the art show? If you guys would put a reaction in on your screen, I would love to see if anyone has taken a minute to look at the art show. And if you haven't, I would really encourage you to do so. I don't know if anyone on this, thank you, Violet. I don't know if anyone on the screen has submitted anything, but I will tell you that the art, it's absolutely stunningly beautiful. There are some things that I'm in awe of the things that people have submitted. So I really encourage you. There was like 75 or 80 people that submitted things. It's online. If you go to the intranet, on the front page of the intranet, it is on the top right-hand corner where it says staff news. If you click on that, actually, let's see here. If you click on that, it's on a story. It's at the very bottom of the link. I'm going to share my screen really quick, just so you can kind of see some of the, let's see, share. It's just too beautiful to miss. So just, and I think there are opportunities, there's positions that can people see this screen? There are so many beautiful pieces of art. This Mandarin duck happens to be one of my favorites, but there's photos, there's actual Oh, Carol Lawrence actually put some stuff in. So one of our own APPs put some stuff in. It's not juried or anything like that. People just put in their art. So I would just highly, if anybody works with Jeff Friedrich, he's put things in. So anyway, I just wanted to really strongly encourage folks to take a look at that. And if you have a minute and you're so inclined, there's an opportunity to put comments in about what your thoughts are on the art. I mean, I know the artists are really appreciative of that. The going in through Chrome is much easier and than going in through Windows, just FYI. That I was just told that today. So look at that. Food cart, if anyone has used or hasn't used the traveling food cart, there is a food cart that is up on 9MB right now, outside the entrance of 9MB. There are salads and sandwiches, chips, cookies, sodas, etc. The salads and the sandwiches are all only available up on the mobile food cart. So if you haven't accessed that and you're interested, please do so. It's up there from 11 to 1:30. Staff had asked to have something a little closer than the cafeteria. So we worked with food services and administration to get a cart and have that food available a little closer to some of the units. It'll be up on 9MB for a while, and then it will move down, I think, to 2 East, but we'll continue to keep that advertising. It's going to be on 9MB for, I think, another 2.5 months, but it's really, really, really great food, really great choices, sandwiches that you can't get down in the cafeteria, salads that you can't get down in the cafeteria. The other thing I wanted to quickly talk about was LMS modules, the things that we love so much. Our UWP compliance modules are now up, as are our hospital, I don't know what they're called, but refresher modules, the fire, et cetera, et cetera. Those started, opened up yesterday. We have until mid-September to complete them. Please just complete them. I'm just gonna ask to please complete them, because it's a huge time commitment to try and find people and have them get this stuff done. So please just do it. That's all I'll ask. And all you have to do is go onto your LMS modules. For those staff that are new, that were hired within the last year, if you don't find the annual compliance modules are through UWP, and you have to do those every year. New hires, if you don't have that stuff on your LMS, it's because you completed it right within your actual hire, so you won't have it again. That's the same with our refresher modules. And let me check and see what else Michelle has on our agenda. It's Safety Awareness Week, if folks didn't know that, and you can go online. It's up in the top left-hand corner, right as the top story on the UW intranet, on our Harborview intranet rather. And you can take a quiz and win a prize, be in a drawing for a prize. The safety team works really hard on Safety Week and just pointing out things that we need to be aware of for our personal safety and our patient safety. So please take a look at that website. Michelle said HMC medical staff observation program as of March 2nd. We'll begin accepting medical staff observation applications for review. If you have any, as we talked about with those open positions earlier, if you have any positions or anybody that might want to come and shadow you for the day, it's a process that we have to follow. There's an application that the shadowee, I guess, needs to fill out. And then you need to sign it, and your division chief or head needs to sign it. And then employee health needs to get it, and they sign off because people have to be fully vaccinated in order to shadow. And then the medical director's office approves the shadow. So some people come to shadow because they're interested in PA school and maybe they know one of us and they want to see what it's like in a hospital. Some people come and want to shadow because they've interviewed and they're really interested in the position that we've offered them, and they want to see what a day in the life of an APP on neurosurgery or general surgery is like. And so that would be another shadow. You just need to make sure that you give the medical director's office at least 2 weeks in advance to get all that paperwork completed. And the date of the shadow needs to be on the paperwork. Sometimes what ends up happening is, since we don't know exactly when the interview is, et cetera, you can say to be determined or give a range of dates and say mutually agreeable, something like that. That seems to have worked. And then once we know for sure what the date is, we just put that exact date in. So please do that. This has nothing to do with whether or not you are precepting a student. So this is really more for the things that I mentioned earlier. And if you want to be a preceptor, please make sure you let Jenny, Michelle, or myself know, and we can work with you to make sure that everything gets done for that student. If preceptors say yes to a student and the student starts and we're not aware of it, they don't get everything that they need to have up and ready by the time that their clinical hours begin, because they need access, they need a badge, et cetera. So, and the other thing, one of my visions for that is, if we know how many people are precepting a student and for how many hours, we can actually share that information with Summer, the Harborview board, with Jay Sandel as our interim CNO. And I think that's really valuable information, since teaching and training is part of our overall educational mission. So enough on that. And then I'm going to let you guys read the slides about the mailing adjustment and the transition of clinics over to NJB, so that mailing can be turned into single patient rooms. That's something that is expected to be done. In fact, I think I'll talk with Michelle about maybe having Ted Kleiner come and talk about that whole project and the scope of the bond project and where we're at and where we intend to be. I believe mailing should be all done, or the idea is that it's going to be done in 2023. And then the other thing I wanted to make sure we talk about is CE hours and CE monies. So everyone is entitled to $2,200 a year based on your FTE. So if your FTE is a 0.5, it's $1,100, et cetera, and 64 hours of continuing education. The 64 hours and the $2,200 is the same whether you're a 0.9 or a 1.0. So for this, it is, you're considered a full-time FTE for our continuing ed funds if you work 0.9. June 15th is the deadline for that, for the request to be reimbursed for those monies. It's super important that those requests to be reimbursed get in and get signed and then get to clinical education by the 15th. There is zero wiggle room on that 15th, that date, that 15th. So I would encourage people to sort of pre-plan, make sure they get that paperwork signed by your administrators so that you can get it into clinical education on time. If your manager isn't available to sign, or they're out on vacation and it doesn't get into clinical education, it doesn't matter. The 15th is a hard deadline because June 30th is the end of the fiscal year, and the books need to be closed on all the monies that were given out to really literally thousands of people, because it's nursing, nurse practitioners, social workers, et cetera. It all goes through those budget areas. And so it's got to be done by the by June 30th. The other thing I think Michelle put in, or Michelle, Jenny and I had talked about is May 1st, 2022 is your last day to request time off for CME. And that's because what we find is we get up to that date when people maybe haven't used 40 hours of their continuing education and they don't want to lose it. So all of these requests come in at the same time and there's overlapping with different, with their peers. And if everyone goes, then we don't have coverage. So we want to just make sure that people get that in so we can plan accordingly. Because I think Jenny, Michelle and I can speak for Jenny and Michelle, we all want everybody, it's a benefit. We all want everybody to be able to use their continuing ed hours and their continuing education time. The only caveat to that is it's got to be related to the work that we do and the care that we provide at Harborview. So if you want to take a pediatric, I don't know, maternal child class, something like that, but you have nothing, there's nothing related to the job that you do with maternal child nursing or provider care, then that would not be acceptable. But literally, I can't think of too many other things that would be limited. There is one class that everyone seems to want, many people want to take, and that is wilderness medicine. Wilderness medicine is a class that you provide emergency care out in the wilderness, and we don't do that here at Harborview. So that's another one that that we don't cover. People can go out, many people have gone to, I personally know someone that went to Mexico for a psychiatric conference. Many people go to Hawaii for conferences. Those are, we approve those conferences, and that's not a problem. But we only approve the conference based on the number of hours that we only approve the hours of continuing education based on the hours that you get during the day, which is fine. So if you're gone for a week and you have 4 hours of continuing education Monday through Friday, then you have to make up what your other hours would be in the day. You can make that up through online training. You can make that up through, you know, if you're reading an article that's a CME article, like many are, you can do that as well, or you have to take benefit time. So we can't pay continuing education hours when you're actually not doing your continuing education. And I think that seems to work really, really well. I think that's it about continuing education. Michelle has some other things related to what we would approve, what we approve for funds. If you have any questions, please don't hesitate to ask. If people are physician assistants often like to take a refresher course, at least that's been my experience, a refresher course prior to taking their 10-year recertification exam. That refresher course is covered. Same thing if there's a nurse practitioner course, which I can't think of one, but anyway, that's covered. Our licenses, our RN and our ARNP license are not covered, but our recertification fees are covered. The licenses aren't covered because it's a requirement of the job to be licensed. And I think, and then Michelle, on the slide deck that she sent, she has a whole bunch of potential clinical education opportunities. So feel free to look at the slide deck that she sent. It's really actually quite good. And let me just check the agenda to see if there's anything else. Talked about the bond training. EDI, there's EDI sessions every month. Do you guys get emails about when they are and what they are? Or caucuses, excuse me. There's the African American or Black caucus. There's a white caucus. I think there is an Asian Pacific Islander caucus that comes out through UW. If you don't get those emails, let us know and we can make sure that you're on those emails when they go out. I think we send it out to PCS, but I just want to make sure if you're not getting them and you're interested that you get on those email lists. And then the other thing, I just wanted to cover briefly, and I think it's kind of exciting, is I've worked with IT and UWP and have been able to get information on all of our billing. There's nothing necessarily related to it in terms of, hey, you're not billing enough, or wow, you're billing so great, this is wonderful. I mean, and it is regardless of what we're doing, because I know everyone is really, really busy. But if you ever have any interest in looking at what your actual billing is by the month or over the course of a year, let me know. I'm happy to share that information. The interesting thing about that is we bill, and I remember when I first started, I got a list of everybody and what all their billing was. And I looked at it and I was just like, oh my God, I've never seen so much money in my life, you know, in terms of all of the things they billed. And basically I got patted on the shoulder and it's like, oh, no, that's what we bill. That isn't what we actually get. And so my balloon was really quickly deflated, because it's about a third of what we bill is what we actually collect from our insurance partners. We do collect a little bit more from our commercial payers, but our commercial payer percentage is much lower than our Medicaid and our Medicare billing. So it kind of all works out in the wash that it's about a third of what we bill. So if someone is billing $300,000, then we get somewhere between $85,000 and $100,000. So once I learned that, it wasn't quite as bad, because we still have a huge important role here at Harborview, and we make up for a lot of different things from other revenue sources. But it's kind of cool to see what we bill. The other thing is it's really it's so variable for so many different reasons. But I think one of the things about billing too that's interesting, but also you look at it and it's like, well, I don't bill very much. A lot of things that nurse practitioners and physician assistants do from a surgical side, it's all in the global package. So say someone has a hip replacement and you're seeing them for follow-up, or you're seeing them on the floor, all the work that you're doing is integral to their getting well, healed, etc. But we just get one lump sum for that particular surgery. And so we don't get to bill on a daily basis, where in clinics, every visit is billed, except if it's a surgical service, because there's a period, the window's usually 90 days. So those follow-up visits in a clinic are really related to the surgery. And so there's no extra billing from a clinic perspective. But if you have a patient that's got diabetes, or you're in the cardiology clinic and you're seeing a patient to follow up on cardiology, every visit is a billed visit if they haven't had any surgery. So it's just kind of interesting and neat, I think, to see what we as individuals contribute to our departments or to the organization in general. So let me know if you're interested, and you could stop by and I can pull your information up. I get a report every month on each APP. So that's all I have. In the last 2 minutes, does anyone have any questions? It's a very quiet group. Jenny, did I leave anything out that you wanted to make sure we covered today?
No, I don't think so. I think we've covered all the topics that we wanted to talk about today.
All right, well, Jenny, Michelle, and myself are always open. Our doors are always open. We might not always be in our offices, but feel free to walk by or send us an email, and we are happy to meet with anyone, or send us an email with questions. We're happy to answer anything you have. So I really want to say thank you for coming today. Thanks for all the hard work. I know it's been 2 years of just unending busyness, and appreciate everyone's sort of stick-to-itiveness in terms of taking such great care of our patients. So thank you. Yeah, thanks everyone.